At this time, I will call the July 12, 2021 Randolph County Board of Health meeting to order. Brooke, I did not receive any emails about public comments. Is there anyone in the group that wants to make a public comment at this time? Okay, hearing none, I'll close the public comment period. Next, board members, on your agenda, you've got the May 10, 2021 minutes from the regular board meeting. Do I hear a motion to approve those as presented?
I make a motion to approve the minutes as presented.
I second the motion.
Okay, you have a motion by Amy Williams, second by Courtney. Any discussion? Okay, all in favor, please say, signify by saying aye. Aye. Opposed? All right, the May 10 regular meeting minutes have been approved. Next on the agenda, board members, is the closed session minutes for May 10, 2021. Do I hear a motion to approve those minutes as presented?
I move that we approve the minutes from the closed session meeting.
All right, we have a motion from Alan Ferguson. Do I hear a second?
Second.
Second from Carrie Hampton. Any discussion? Okay, all in favor, please signify by saying aye.
Aye.
Opposed? All right, motion carries. Those minutes for the closed session, May 10, are approved. Finally, board members, the approval of the closed and open session meeting minutes for May 24, 2021. Do I hear a motion to approve those as presented? All right, it's a motion from Carrie Hampton. Do I hear a second?
Second.
Second from Hope Haywood. Any discussion? All right, all in favor signify by stating aye.
Aye.
Opposed? All right, those minutes have been approved. Next on the agenda, we've got Tara Aker, and that will be the policy review and approval. And as she's coming up, let's welcome Tara, our new public health director. Thank you, Tara.
Thank you all very much. It's good to be here. As the agenda says, we are going to do policy review and approval. According to our department policy, we review policies annually, make any revisions necessary, and move forward with that. So some of these policies that we're going to look at, the changes are very minimum, and I'll go through and highlight what those changes are. The first one is the Randolph County Board of Health Orientation and Ongoing Training Policy. The only change to this policy is that to reflect our rebrand that happened in 2019, we went from Health Department to Public Health. So that's what that policy change is. The next policy, the Board of Health Adjudication Policy, we just cleaned this one up, tweaking some wording like instead of presented with, we changed it, instead of dealing with, we changed it to presented with. And Brooks highlighted all the changes. We just cleaned it up so that it reads a little more, it has a better flow to it. And again, we changed the wording from Health Department to Public Health. The next policy, delinquent and uncollectible counts, there's a few more changes to this one than the others. Again, the rebrand changes are reflected throughout the policy. We added the term to definition number 2. We added confidential client as part of that definition. And then we just got more specific with some of our positions. And then attachments 1, 2, and 3 added to explain in detail specific procedures. So those are at the back. That just gives folks, when they're looking at this policy, a step-by-step on what they should be looking for. And then number 2, you may have to help me with this one, Brooke. Is this number 2 in write-off balances? the page 3, the very bottom. We added no payment, no service, or no in-person to that piece. And then lastly, we tweaked the piece. It used to say that the finance person would get the report late September, but we tweaked that one for the first week of September so that we can get that information to you all in time for the September Board of Health meeting. That's it for that policy. Recruitment, retention, and workforce development policy. Again, this one is rebrand changes only, Health Department to Public Health. And then the electronic medical record policy, we changed the title to electronic health records so that we're being consistent in how we refer to that in the department. And then again, the rebrand. Does anybody have questions about any of those?
Any questions, board members? Tara, real quick, that September date, does that still give you enough time to get everything for our board meeting?
I think it does, yeah.
All right.
You agree with that, Brooke, because you're more hands-on in that?
Sure.
Yeah,
Okay.
because it's, our fiscal year end is still not closed out for last fiscal year.
And one other question that just came to mind, is there a group in Raleigh that helps with these policies, or is it strictly a local decision?
We may get some guidance. Like, I'll say this, our lab director, she works very closely with our consultant with the state lab at writing her policies. These policies we write based on how we at our department do our services. Now, they may be similar to other health departments, but you know, Susan used to always say, if you've seen one health department, you've seen one health department. There may be similarities in how we do things, but these are specific to us. I will say we get feedback from Gay Welsh, you know, as far as our accreditation goes. She's our consultant for accreditation, so she does help provide some guidance. And of course, we would always reach out to a consultant specific to a certain program for guidance if we need it. Does that answer your question?
Yeah, it does. I just know with the school system, the state school board association wrote policies, and then we adopted those from a school system perspective and made changes that fit our needs. So I'm just curious with that. If you have to
These
come
are
up-
specific to us. You know, there's pieces pulled from like agreement addenda or things like that, but these are specific to how we do things here.
All right, thank you, Tara. Any other questions or comments from the board? All right, do I hear a motion to approve the policies as presented?
So moved.
Is that Julie?
No,
Hope, I'm sorry. All right, have a motion from Hope. Do I hear a second?
I'll second.
Julie May. All right, any discussion? All in favor, signify by stating aye.
Aye.
Any opposed? All right, motion carries, so the policies are approved. We've got one recension.
Yeah, this next policy is the spay and neuter of adoptable dogs and cats. We're asking that this policy be rescinded because Animal Services is now its own standalone department, and it's no longer applicable to us.
Okay. Any questions or comments from the board? All right, do I hear a motion to rescind the spay neuter policy as presented?
So moved.
Got a motion from Alan Ferguson. Do I hear a second?
Second.
Second, Amy Williams. All right, any discussion? All in favor, signify by stating aye.
Aye.
Opposed? All right, motion carries. All right, next on the agenda is Wendy Kennan, and that'll be the State of the County Health Report.
Just let me get my laptop on there. Hang on just a minute. Okay, of course, I forgot my clicker, so bear with me. Excuse me. As Marty stated, my name is Wendy Kennan. I'm the lead health educator here at the health department. Some of you have heard me present before. It has been over a year since I presented the 2019 community health assessment to you, and literally right after that, we shut down. So I'm just going to present a little bit of an overview of what the State of the County Health Report is. First, I'm going to let you know what the community health assessment is. That's what I did present to some of you last year. The community health assessment is something that we do every 3 years in conjunction with Randolph Health. The health assessment is also called the CHA. It is to evaluate the health status of the county and to determine how our county relates to our peer counties. We have 4 peer counties. Those counties are Craven, Davidson, Harnett, and Johnston. Also, the purpose of the CHA is to identify and prioritize health issues that are identified so that we can make action plans, or what are now called community health improvement plans, to work on over the 3 years that we have until we do our next health assessment. So during the 2 interim years that we're not doing a health assessment, we're doing a State of the County Health Report, which is also called the SOCH, which is what I'm going to kind of go over with y'all tonight. What I was talking to Tara about, the CHA is more of the meat, and the SOCH is more of your carrots and potatoes. It's a report and an update as to where we've come since we've done the health assessments. So let me go ahead and say what we've worked on is for our community health improvement plan. This SOCH is going to be way shorter than it ever has been, considering the last year we've had. Randolph County Public Health met with our Community Health Assessment Advisory Board on August 22nd, 2019. 3 priority areas were identified at that meeting: early and middle childhood, health-related quality of life and well-being, and mental health. The CHA was submitted March 2nd, 2020. A day later, the Emergency Operations Center, known as the EOC, was opened, delaying the CHA timeline that we had in place to develop our community health improvement plans. So everything pretty much came to a halt at that point. Per the state, we were allowed to just put everything on hold until COVID kind of slowed down to some extent. So because of that, and at the end of this month, and y'all were invited, some of y'all have accepted to come, we're going to have the CHA Advisory Committee reconvene July 27th. And the purpose of that meeting is going to be to complete the community health improvement plans and to develop subcommittees that will work on those identified priorities if we choose to keep those identified priorities. We can abandon some and we can kind of back up and punt and decide if we want to identify others that were chosen from the 2019 meeting that we had. Okay, so another part of the CHIPS, Randolph County Public Health has completed or is in the process of working on the following: adopting results-based accountability. And what that is the training I just actually recently went through. It's what the state is calling turn the curve thinking. It is 5 different strategies. How are we doing? What is the story? Who are the partners? What works? And what is our action? So that's what we're also going to look at when we're meeting on the July 27th, answering those questions based on what objectives we're going to identify. We're also transitioning the CHIPS from paper-based to web-based. We're setting up results, indicators, programs, and performance measures to put in the Clear Impact Scoreboard. Scorecard, I say that wrong every time, scorecard. It's our electronic database that we now use as far as reporting our SOCH and our CHA. And then we're also going to be linking the Healthy North Carolina 2030 objectives to the 3 identified priorities. And that's what you see here. Actually, can y'all see this? Okay. I'm looking at it, I don't know if you are. So with these objectives that are listed under these priority areas, we had to choose them from Healthy North Carolina 2030's document, which did not come out until end of December 2019. So in order to submit our CHA 2019, we had to have some objectives under our priority areas. So these are the ones that we're going to discuss on July 27th and decide if these are the ones we really can work towards over the next, and it's supposed to be 3 years. It'll now be 2 years, obviously, because we lost a year. But so that we can determine if we can still function to work on these or if we need to abandon some and choose something else. Okay, so the next thing is going to be the leading causes of death. This is the data, morbidity and mortality changes since the CHA of 2019. Here are the 10 leading causes of death, and the time frame for these leading causes of death were 2014 to 18. The state's always a couple years behind on data. Changes from the 2000, whoops, y'all don't have that slide because I'm leaving that one up for y'all to look at. Okay. So the leading causes of death, the differences since the 2019 CHA, and the CHA data was 2013 to 17. Diseases of the heart was ranked number 1, cancer ranked number 2. Every year we do this, cancer and heart disease generally flip-flop 1 to 2. They're always number 1 or number 2 generally. Stroke diseases dropped from number 4 to number 5. Suicide replaced kidney or diseases of the kidney. And it should be noted that suicide was not even on the leading causes of death in 2019. I think it was like number 11 or number 12, and it's now for 2020, it was number 8. Chronic liver respiratory disease replaced influenza and pneumonia for number 9, and influenza and pneumonia replaced motor vehicle injuries for number 10. So as you can imagine, what we're going to be looking at for 2021, which is actually 2020 information for COVID-19. So it's going to be interesting to see what the report looks like next year. All right, so here's a little bit more mortality and morbidity information. I won't read it to you, but mainly we just look at cancer deaths, cancer mortality, and then infant child mortality. And these numbers aren't really, I mean, they're concerning, obviously, but there's not a big drastic difference from year to year on these numbers that were reported. And y'all ready for me to go on? Okay. Okay, lastly, we have emerging issues. On December 31st, 2019, we had a patient that was reported positive for TB. The patient began TB medication on January 1st, 2020. Directly observed therapy, also DOT, was done at the home of the patient at that time. The patient exposed 21 individuals, 7 of those individuals being children. None of those individuals, however, developed TB. The patient completed treatment on July 29th, 2020. In an unrelated case, another patient tested positive on July 29th, 2020. That patient began TB medication on July 29th. DOT at that time was done via FaceTime because of COVID-19 and us being in the EOC unable to go out into the homes of the folks. 6 adults were exposed by that individual. None of them also developed TB, and that patient completed treatment in May of 2021. So, no surprise that COVID is going to be on our emergent issues for 2020. The Emergency Operations Center, EOC, opened on March 4th, 2020. We de-escalated that EOC on February 3rd, 2021. The first reported case of the county for COVID-19 was on March 23rd, 2020. At that time, we had 15,000, at the time of this, when this report was submitted to the state, we had 15,160 cases and 230 deaths of COVID-19. Public Health began vaccinating staff and first responders on December 30th, 2020. And as of 5/21, May 21st, when this report was submitted, we had vaccinated first doses of 14,409. We had administered 13,589 second doses, totaling 27,998. And I'm sure in Tara's health director report, she's going to give you those updated numbers as of now.
Okay, so these are the vaccines that we administered through the health department.
Yes, ma'am. Strictly public health numbers.
Okay.
Yeah.
But our numbers, when we look at our numbers of vaccinated residents, are they these numbers? Or do they include people vaccinated in other counties?
These numbers are, that's a good question.
I said, these are the number of vaccinations that our staff has given or responsible for.
Right, and it includes anybody from any other county.
Or whoever, right. But my question was, how do we know citizens what are the numbers on citizens who received the vaccine elsewhere? Do you have that at the health department? Because early, when there was such a demand, there were citizens that were going other places, and then there were people that were coming here, which is fine, but I'd just be interested to know if we have, if when we say 31% of our citizens have been vaccinated, is that how many have been vaccinated?
Yes, the data that's on
Regardless of where they got it.
NCDHS's website, that's specific to Randolph County,
Okay.
folks that live in Randolph County.
Okay, regardless of where they got it.
Correct.
Okay, all right.
Thank you. Okay.
Sorry,
No.
threw you a curveball.
Okay, and lastly, as far as emerging issues that we usually report is the communicable disease trends. There was an increase in sexually transmitted infections for fiscal year 19-20 compared to the previous year. And then there was a decrease in the other communicable disease numbers due to the COVID-19 pandemic. April and Lindsay hypothesized pretty much that this was a result that more doctors were doing telehealth visits and not in-office visits, so therefore testing was not necessarily being done. Okay, and that concludes my part of the report. Do y'all have any other questions?
Okay, of course I have another. For the meeting later in July, will anybody from Randolph Health be there?
Yes, ma'am. We've invited all of our community agencies. I would say there's probably 40 some maybe that were on that invite list. I've only heard maybe or gotten RSVP from half of that, but yes, there will be somebody from Randolph Health there.
Okay. Since it's under new ownership, I just think they would find it, that they might find this interesting information.
And I'll be honest with you, we've always worked with one individual mainly from Randolph Health. So if you've got other suggestions as to somebody that you might think we should invite to that may not be apprised to the CHA situation or to the SOCH and to the CHIPS, then just please do let me or Tara or Brooke know, and we can certainly add them to that list.
Okay.
And that goes for any other community agency, if y'all think that might benefit from that. I mean, we've invited most of our community agency partners that we work with closely, the Partnership for Children, the hospital. Of course, I can't tell you any of the rest of them right now. Y'all, school systems, some physician offices, library, county department heads, and so forth. So if y'all think of anything else, then y'all please just let us know, and we'll see if we can't add them to it. Okay,
You mentioned 4 peer counties, and I wrote down 3 of the 4. Can
Okay.
you give me those again?
I can. Craven,
Craven.
was that the one you don't have?
Yes. Davidson, Harnett, and Johnston?
Yes.
Okay, thank you.
Yes. And peer counties are chosen from the state based on population similarities with other, compared to Randolph County. Okay, thank y'all very much.
Thank you, Wendy. All right, next on the agenda, we have the clinical fee.
Oh, and I will say, there are some reports up here for the 2019 CHA and the executive summary. Should you all want any, y'all can have some.
Okay, thank you. Next, we have the clinical fee change proposal. Tara?
And I'll just add, links to these documents will be sent out if you don't want a paper copy. Actually, you can find it on our website now under data. But when we hold that meeting at the end of July, there's going to be an email that goes out and say, hey, this is the date, this is time, this is location. We'll include links to these, and if we can remember to send out the Healthy North Carolinians document, I think.
I've got an email that needs to go out about that.
So that y'all can have that in front of you. And possibly we could attach previous SOCHs so that you guys will have an idea, because there's probably some of our chips that may be similar to what we've done before. I just find it helpful. You can look back and say, oh, that's what we did. That's what our objectives were to accomplish. Anyway, and before I get to this fee, I want to recognize, you all know that as part of new public health orientation, we ask our staff to attend a county commissioners meeting and a Board of Health meeting. So we have several folks here that are, I would like to say they're here to support me, but they're probably here to finish their new employee orientation. I'll start over here. We have Tara Lancaster on the back row over here. She's our new dental assistant in the dental clinic. Y'all know the rest of them. And then we have Amaris Avalos. She's a health educator in health education. She's one of the positions that we got approved last summer. As part of the COVID, we saw the need that we needed a bilingual health educator. So she is new to us, almost a year now. Not quite, but coming up. And then we have Melissa Thompson. No P. She will correct you in a heartbeat. I always have to look at her title because it's a little tricky, so I'm not going to get this wrong, Melissa. She is a health education and outreach support specialist. She joined us from Mercy. You're a health coach. She's really good at outreach. She's got a lot of contacts in the community, so she's been a real good asset, as they all have been. We have Danielle Fisher. She is a public health nurse, too. She works in our case management program. And then there's Elizabeth Avila. So Elizabeth is not new, but she's a new supervisor. So I think she's just checking things out, see how things work, which is great. But she's a foreign language interpreter, and she just recently became the clerical staff supervisor. And then there's Maria James Losa. She joined us last July 1st, is that right? She's also a foreign language interpreter. She joined us, and she didn't get to foreign language interpret at all in the health department. She came, we stole her, and she came to the EOC, and she did a really good job. She got chewed out multiple times, as did Amaris and Melissa and everybody else that was in the EOC. But they did a great job. It was stressful times, and that's what people did, and that's what we do. And last but not least is Yesenia Sains. She is a processing assistant in our dental clinic. So how long have you been with us, Yesenia? She joined us during COVID, so all these people we just showed up one day and they were there. But we're happy to have Yesenia and the rest on our team. All right, back to our fee. So when we submitted fees for your approval back in May, we thought we had dotted all our I's, crossed all our T's. We weren't going to have to come back and ask for any new fee adjustments. Well, we were close. We were real close. I'm going to have to read this to you because this is a tricky reason for a fee change. So back in May, when we made our fee proposal, we proposed that we increase our depot fee from $51 to $55. Well, our electronic health record is a little bit tricky. When we enter our fees into our EHR, the fee dollar amount cannot exceed 2 decimal places. It has to be 10 dot whatever, not necessarily 10, but you get my point. When we entered the service for depot, we have to enter the service in units. The depot injection is a 150 milligram dose, and our EHR views 1 milligram as 1 unit, meaning we have to enter 150 units for a depot shot. This means our fee for depot has to be divisible by 150. And when you do 150, $55 is not divisible by 150. It comes up to 0.36666. So clearly that exceeds our 2 decimal places. So, saying all that, we're proposing to adjust our depot fee to $57, which is divisible by 150, which comes to 38 cents per unit. Does all that make sense?
Makes sense, the things we do.
It was quite interesting to figure that one out today. Does anybody have questions about that?
Any questions? Does this have to go back before the commissioners?
Yes.
Okay. All right, good luck.
That's why we try to get it right the first time.
All right. All right, board members, we've heard the explanation for the clinical fee change. Do I hear a motion to approve the fee change as presented? All right, got a motion from Carrie Hampton. Do I hear a second?
Second.
Hope Haywood. All in favor, signify by stating aye. Opposed? All right, motion carries. Fee has been approved. Next on the agenda is the communicable disease update, and then again, Tara.
I'll start off with a quick COVID update. As of today, Randolph County has had a total of 15,400 positive cases since March of 2020. If you guys have been looking at our weekly update, you'll kind of notice our numbers have been kind of leveling off. Week before last, we saw the lowest number of new positive cases that we've seen since way back in the beginning. Week before last, we only had 20 new cases. Last week, we had 37 new cases, and when I went back 6 weeks, we've averaged about 37 new cases per week, which, while it's good, we're holding our breath because we are concerned about the Delta variant and the potential for another spike this fall. So, again, if anybody's listening, we're still encouraging that vaccine to. We don't want another spike. We want this to go away. We are maintaining at 232 deaths. I'm happy to report that we currently have 0 outbreaks, so that's clear that it's, saying this vaccine's working. The last outbreak that we had in a congregate living site was 2 staff. So the staff are taking it in, the residents have gotten the vaccine, so they're staying well. Testing continues to decline. I asked StarMed, they do testing 2 days in Archdale at RCC and 2 days here in Ashboro. They're not seeing many folks at all. They're averaging about 5 individuals a day per testing day. Our percent positive as of today is 2.6%, which is good, but like it a little bit lower. And just to give you all an update on our vaccine, at Randolph County Public Health, we've administered a total of 29,295 doses. That's first and second. First, we've administered 14,851. Second doses, 14,444. And those numbers continue to decline as well. We always are trying to brainstorm about how to get vaccine out. Switching strategies, we may go down to 1 day where we're doing first and second doses. First doses in the morning, second in the afternoon. We're open to suggestions that anybody might have. We are hoping, if all goes well, we got confirmation this afternoon, we should be going out to a farm later this week, a migrant farm, and hopefully getting about 18 of those migrant workers that came to work vaccinated. StarMed continues to assist with vaccine in the community. They may be starting to back off on their vaccine events at the Archdale RCC location. They were doing it on Wednesdays, but the numbers just aren't there. In 7 weeks, they've administered 14 vaccines. And that's even with offering a $25 summer cash card, so the interest is just waning. But they have been great at assisting with community events. If folks call us and say, our church or we've got an event coming up, can you hook us up with vaccine? They helped with the zoo event. The zoo did those 2 different weeks where they did a 3-day event. There we got just over 235 vaccines administered there, which was good. 4 Saints had about 9. They held an event at the First United Methodist Church. They did an event at the George Washington Carver Community Enrichment Center, about 11 people there. The Y did an event, and they'll do a follow-up event next week. And then they've been to some businesses. They just did an event maybe 2 weeks ago for Klausner and Prestige on site for their employees, which had a decent turnout. They had 36 show up. I'm happy to report that the Randolph County Detention Center is now offering vaccine to their inmates. That's been about 3 weeks, 4 weeks now. Medico is their healthcare provider, and Medico was able to work it out with their pharmacy to get Johnson & Johnson, which was the ideal vaccine for that situation. So we're happy to report they've administered between 115 and 125 doses, which is good. As far as Randolph County-wide totals, which you were talking about earlier, the numbers from the state's website, in Randolph County, the number of individuals that have received at least one dose is 47,649, or 33%, and we've kind of been hanging there for a little while. And then fully vaccinated is 45,060, which is 31%. Shifting gears to hepatitis A. There's been an ongoing outbreak of hepatitis A that started out west and has gradually made its way east, and it's here. Prior to COVID, Randolph County Public Health, we were proactive. We got into the detention center, got a lot of the inmates vaccinated. We put together materials and shared it with community partners so they could get education, information about getting the vaccine into the hands of individuals that were at highest risk. Then COVID hit. I think I've mentioned to you all before that fiscal year 1920, Randolph County Public Health, we reported 3 total hepatitis A cases for the county. According to the Communicable Disease Branch, from April 1st, 2018 to June 9th, 2021, Randolph County has 60 hepatitis A cases that are associated with the North Carolina outbreak. And that outbreak is mostly, they've tied it to 3 risk groups. So there may be other hepatitis A cases, but the outbreak is specific to 3 risk groups. And those risk groups are individuals that use IV and they're IV or non-IV drug users, folks that are homeless, and then men who have sex with men. We, as of third quarter, we've reported 92 cases. So we speculate that some of those that are not part of the outbreak, they either didn't report that they were part of those risk groups, or they're just separate cases. So what are we doing to help this problem? So we have a plan. We're implementing that plan, and we actually presented our plan to the state. They want to talk about it, and they were very pleased with our plan. So we've put together 1,000 goodie bags, and in those goodie bags are educational and resource information about, how to prevent Hep A, where you can get the vaccine, encouraging people to get the vaccine. We've put condoms, we've put sanitizer, we've put bottled water, things that will encourage good hygiene, safe sex practices, those kinds of things. And we're getting those goodie bags to our community partners that may cross paths with individuals in those 3 risk categories. I'm not going to mention everybody, but I'm going to try. Our health education team, they've knocked this out. They've been all over the place. Goodie bags are at the detention center. Goodie bags are at our office, of course. Alcohol and drug services, the hospital emergency department, CUOC, Journey Church. They have a homeless person ministry. They're giving them out. The list goes on and on. We're getting down to how many bags we got left, girls? It's under 200 now. And we started with 1,000 just a couple of weeks ago.
It's all those 2 right there.
Amaris and Melissa. So we're getting that information out. I asked Lindsay Saunders, our clinic nurse manager, if we've been seeing folks in clinic giving Hep A in clinic. She says we've given a handful of our STD clients the vaccine. But we're also working with the detention center. We're Right now, the detention center has a vaccine refrigerator, but it's not a commercial, like what we use top-of-the-line commercial vaccine refrigerators. We have to, and we monitor it very closely to make sure that the vaccine stays safe and viable. Excuse me. Anyway, we have gotten permission to use some of our COVID funds to assist the detention center with getting a commercial vaccine refrigerator for their COVID vaccine. And we're going to double up on that and get hepatitis A vaccine in the detention center so that Medico, in addition to giving COVID vaccine, can give Hep A vaccine to inmates. It's much better for them to be able to give it because, we can go, but we're only hitting whatever population is there at that time. Whereas Medico can give it, and they're hitting whoever's coming in the door if they accept it. So that's in the works. We've been to the Shelter of Hope. I've administered some Hep A there as well as COVID. We've initiated a conversation with Our Daily Bread to talk about getting COVID vaccine there as well as hepatitis A. And then, of course, anybody's welcome to come to the health department and get hepatitis A vaccine. Shifting gears again to TB. You heard Wendy talk about emerging issues with TB. Unfortunately, knock on wood. But it seems like when one TB case ends, another one pops up. As of the end of last week, we have 2 people that were being investigated for TB. And I think as of late Friday, 1 has been cleared. There's no association between these 2. I think these folks just went to the doctor, had a unusual x-ray or a skin rash or something that was questionable. So we collected sputums and are looking to see if they're showing any, if they're testing positive for TB. We do have 5 people that will soon start on latent TB infection medication. And these individuals, it just means the latent just means they've been exposed at some point in their life. And we just want to make sure that nothing ever manifests itself. And once they start taking meds, they'll do so for 4 months. And that's pretty much it for the communicable disease update. Does anybody have questions?
I had a question, Tara, and going back to what you said about StarMed, I wanted to be sure I heard this right. Did you say they had just done 14 in the last period of time?
Yes, StarMed has been doing vaccine on Wednesdays only for 7 weeks at the RCC Archdale location, and they've administered 14 total vaccines.
In the last 7?
Yes.
Thank you.
You're welcome.
Any other questions or comments? Okay, next is the Health Director's Report.
So this one's pretty brief. I do want to highlight the great work that our dental director and dentist is doing, Dr. Mustafa. I think you guys have met her. She has just done a phenomenal job. We often say she came on board in fall before COVID hit. Young dentist, just coming out of private practice, thrown into public health, trying to figure that out, and she's done a phenomenal job. We often said that a lot of folks would have said, I can't do this, I'm leaving. But she has not. She's got a great team. She's driven. But not long after, it was in June sometime maybe, it was after our last board meeting, of course, but we were notified that a grant that she had applied for, a Duke Endowment grant, that we were awarded $375,000. Yes, we applied for $400, but we'll take $375, and it'll be awarded over 2 years. We'll get $250,000 this year, and then get $125,000 next year. And the grant funds will be used to expand the services that we can provide in schools. Right now, we can only do screenings in schools, but this grant will allow us to purchase a Sprinter van and take our equipment into schools to do x-rays, cleanings, fluoride, those kinds of things. And our plan is to target 8 elementary schools, and it's the elementary schools that have the highest poverty rates. And then if kids that need referrals, they'll be referred back to our brick and mortar clinic for services there. It will take us into the schools to get the information out. We'll have to go to open houses when school starts because we hope to hit the ground running as soon as we can this fall. Of course, we'll have to get consents and things like that, but we're excited about this program. The next update is the Assistant Health Director position. We have filled that position. You all may remember Jennifer Layton. She interviewed for the Health Director position. She also applied for the Assistant Health Director position. And if you all remember, she is an employee right now at Stanley County Health Department, has been there 8.5 years, has a health education background, has a lot of relevant experience that an Assistant Health Director needs. Accreditation, quality improvement. She actually has done preparedness. So anyway, we're excited that she has accepted the position and she will join us August 2nd. So next time we meet, she'll be here. And then last but not least, we try to keep you all informed about what's happening as much as we can, and I hope to continue that. I'd like to provide you all with periodic updates. I know Marty and I talked about, we have management team meetings monthly as much as we can, and I've thought about providing you all with an update. That's where all of our managers, our program managers, we all get together and we talk about what's happening in different programs. So I'm considering sending you all an update after those meetings so that you'll know what's currently happening in our program areas. But I've also thought about, in addition to that, bringing our program managers in front of you more often so that you can hear from them directly about what's going on in programs. Like this time of year is a busy time of year for our on-site wastewater program and our food and lodging program. They could tell you all about public swimming pools because they're up to their necks with that right now. Or food trucks because those just keep coming. So anyway, that's a thought. But we'd like to get you guys up to speed on accreditation. I don't know if you guys have ever had a training on accreditation. It'd be exciting. Or the 10 essential public health services, putting that out in front of you guys so that you're more familiar with what that is. But right now, I would like to solicit from you all, and you don't have to answer me now, but I'm just putting it out there. If there's certain topics or information that about different programs that we provide, if there's something you would like to hear more about, let me know now, send me an email, Brooke an email, because we're happy to provide that for you guys. But that's it for my report.
Thank you. I think Tara's certainly hit the ground running June 1st, and so we appreciate all that you and your staff are doing. And ladies, thank you for being here tonight. I know we'll see you next time. I know you want to come back and join us again, so we appreciate your time and certainly appreciate what you guys do for us in Randolph County to support Tara and the Public Health Department. So thank you for what you do. We appreciate it. Anybody else? Any other comments?
I'd just like to say to her comment and those ideas, I think they're all excellent ideas. I mean, I think it would be interesting for us to know, what happens with, what do you see in Randolph County with swimming pools, and, what is the process with food trucks? They're such a big, a big thing right now, and I just think it would be interesting for us to have some information about what that inspection process looks like for food trucks, and then meeting the people we have that are in charge of different programs. And I think all of these are valuable suggestions.
And I'll make the offer that I made to Alan, and I know I've made it to, during normal times when we're not having to do things remotely, when a new board member comes on board, we do an new board member orientation, and we make the offer. We're happy to give you a tour of the facility, but we also offer the opportunity, and any of you are welcome, you could do a ride-along with environmental health if you wanted to go out and look at a food truck or follow along on a food service inspection or a swimming pool inspection or a soil evaluation for a septic system or a well situation where a well might be going in. You guys are welcome to do that anytime. Just let me know and we'll hook you up. Our folks hadn't got to experience that because we've not been doing regular employee orientation, but traditionally when our new employees come on board, the ride along with environmental health is one of the more enjoyable things because you get to see what makes up a restaurant inspection. So, but we'd be happy to arrange that anytime.
Okay, thank you. Thank you, Hope. Anybody else? All right, if there's no further business, I'll ask for a motion to adjourn the meeting. Motion from Courtney. Do I hear second? Second from Carrie. All in favor, signify by stating aye. Aye. All right, we are adjourned. Thank you for being here.